So I'm an ecologist and a vet, and I'm working for CIRAD, which is a French research organization working for development of agriculture and environmental conservation. I will also save a bit of time, but not reading this very long title, but I'll try to take you through cross and really interdisciplinary realms. I mean, as I mentioned, my background is more on health, and what I would like to show you is how we try to situate health in socio-ecological theory and practice, and maybe some avenues for more collaboration, because I think there are a lot of synergies that we can explore. Just go back. I've had the privilege to work with in two very different contexts. So the first one with our colleagues from the research platform Production and Conservation in Partnership over the past, for nearly 10 years, with colleagues from Zimbabwe, from France, and including, of course, Hervé and Chloe. So that was in Southern Africa. And also I lived and worked for the past 8 years in Southeast Asia, based in Thailand, also working on similar questions with another network with Thailand, Cambodia, and Laos, which I will talk a little bit more in details. So to acknowledge also the collaboration and the active participation of all these co-authors. So next, please. So why bother exploring these links between two very different, complicated things, between socio-ecological systems and this nexus between biodiversity, agriculture, and health? Well, the first reason is because there are a lot of growing empirical evidence that the health and well-being of people are closely interlinked and linked with the agroecological and socio-economic environment in which they live. So there are some ecological evidence. I don't know if you heard about this dilution effect, but which basically states that in population of plants or animals, and it's also working for humans, basically when you increase the diversity, you increase the pathogen diversity, but you also decrease the overall infection. So this is what we call dilution effect. So that's good news. And the second one is, if you take an inclusive definition of health and well-being, there are also a lot more evidence that mental health of humans is definitely increasing and benefiting from frequent interactions with biodiverse environments. Oops. So the second reason is there are strategic opportunities for synergizing biodiversity conservation and agroecological transitions. On our side, health and well-being are very powerful leverages for transformative actions of socio-ecological systems. So just no one can be against healthy food or healthy agrosystems that are actually resulting from the diversification or the preservation of biodiversity. So clearly, healthy food and agrosystems are good for your physical, economic, and mental health. A bit of context also. There are clearly, I don't know how many of you have heard about the One Health, Eco-Health movements and perspective, but basically over the past 2 decades, there has been approaches developed in public health and veterinary health that have widened the scope of handling these questions about zoonotic diseases. So at first it was really about human health and animal health, but then was widened to vector-borne diseases, and also obviously the link with emerging diseases from livestock and wildlife. And progressively all these were extended to include also the links with biodiversity and health and nature and well-being, and also scaled up from human perspectives to the planet including also non-communicable diseases like pollution, pesticides. So to come with this notion of health of ecosystem and health of the planet. So this is one of the frameworks that were proposed, and especially for a perspective of interdisciplinary and intersectorial collaboration, where basically One Health is resulting from the interaction between health of humans, animals, environment, and different disciplines that are associated. And that's clearly a proto-socio-ecosystem, isn't it? So that was a base that was referred to for moving on and to try to merge these notions of health within socio-ecosystems. And we pursued that to try to connect with other work that were done, so the work, early work of Holling, and then the perspective on socioeconomic and by Ostrom and colleagues, but also the work by Bruce Wilcox that started through the eco-health perspective, and then later on really tried to merge these two bodies of thinking. So we pursued that, and also published a number of papers showing how important it was to use this type of frameworks for both promoting interdisciplinary and cross-sectoral collaboration, and with that perspective, putting emphasis on the participatory modeling that is absolutely essential to have some kind of a synthesis of the different perspective of the different stakeholders. So it's absolutely a necessity with the socio-ecosystem health perspective. And we finally came out with an operational practical framework linking the different components of health, what we call health in and health of the socio-ecosystems. So it's basically stating that any social ecological system can be broken down into different components, humans, animals, socio-economic, as what we've seen with the socio-ecosystem representation of the One Health, and that all these are interacting, animal health with human health, environmental health, but also all the governance and human environmental health. But that all these interactions are actually also influencing the socio-ecosystem, the status of the whole socio-ecosystem, which to some extent can correspond to the resilience of your system or the sustainability of your system. And then the whole participatory approaches is to try to explicitly, with the, through transdisciplinary approaches, to try to define what are the different links and what is the state of the socio-ecosystem that we're talking about. One of the advantages also is that it allowed us to link with the different school of thoughts that were evolved during the past 20 years, eco-health, global health, to define the components, health of the different components, interacting for resulting the health of the whole socio-ecosystem. So that was the theoretical framework, and we used this framework as an heuristic for interdisciplinary definitions of the One Health projects. So this first one was about diseases, tick and tick-borne diseases in south of France. Another one was with colleagues in Vietnam, looking at livestock health and productions, always using these different interactions between the components of health and the socio-ecosystem health as an heuristic for defining what would be the research question that we can address through the project. We also use that in different contexts, but also as a research and multidisciplinary tool for academic integration. So that was with Hervé and colleagues in Southern Africa, based in Zimbabwe. And this one was much more in practice for implementing a transformating project. But I have only 2 minutes, so I'll definitely skip very quickly through that one. Yeah. To move to another very concrete case where we implemented that. So that's a project called Healthy Territories, which works on this. The objective is to link the health of the women, animal, plants, as a leverage for the development of agroecological transition. So the principle was to establish, it was working in 4 countries, 2 in Western Africa, in Senegal, but also in Benin, and 2 in Laos and Cambodia. Without getting into the detail, the context is intensive agriculture with rice farming at the prime production, but also in these areas there are some bat caves, and including bat species that are very close to the one that are supposed to be ancestors or reservoir for the coronavirus that emerged and provoked the COVID-19 pandemic. So we based the whole participatory approach on companion modeling approach with defining, co-designing with the farmers and the local stakeholders the question on which we wanted, so the problem statement, and everything was really actually centered on improving the soil quality and water to maintain health, animal, and the environment. But the main focus was definitely on quality of soil, so that's what you would expect for a transformative agriculture transition. One thing that was very interesting is that when we listed the different components of health on which the participants wanted to have a transformating action, plant, crops, and water and soil were the main items they wanted to change. The actors that were associated were the community, but also the technical actors like research NGOs and the local authorities that may have power to change these outcomes. And most of the health linking the actors and the components were actually changing practices linked with pesticides or chemical inputs that would have a direct impact on these transitions. I'm moving that one to conclude. I've seen your sign. It's okay. Finishing on that, just to say that this concept of socio-ecological system is very useful because it provides a heuristic to illustrate these health linkages with other sectors. The transdisciplinary co-design of health and well-being issues with local communities allows for local knowledge, perception, and values to guide interventions. But obviously, we expect surprises, as in any of these transformative socio-ecosystem-based intervention, and especially in an area that was supposed to be very exposed to COVID spillover. We had the surprise to see that this was absolutely not the priority health worry of the stakeholders. And the last thing about the way forward, we need to explore, and that's a very strong push from the donors especially, but also decision makers, to explore effective mechanisms for scaling up these approaches and scaling out. The second thing is one modeling challenge, because very often what we found is that on the ground for participants, health is not a status, it's more of a process. And you need to find a way to communicate and translate that into modeling perspective. And the last thing is, I would like to, it's very urgent, to change from this to a positive attitude with trying to demonstrate that when we restore biodiversity, we actually have an impact, positive impact on the health of the people or the animals in which they live. So move from this to, yes, something is working. Thank you.